is Shadi and I'm a community health worker with Mental Health Partners, focusing on getting teens and young adults better access to mental health services and breaking down some of the barriers that this population seems with receiving mental health services. In our previous video, we just discussed over the basics of mental health and why it's important not to neglect our mental health as teen and young adults. And in this video here, I'm going to be talking about more of how to navigate those conversations with your teen and young adult as parents and caregivers. To begin, we've already gone over basics of mental health and normalizing mental health care. I want to jump in to how you as parents and caregivers can facilitate those mental health conversations with your teen and young adult. And the steps that I'm about to speak to you in this following video come from our youth mental health first aid training. First and foremost, I think it's important to find a comfortable and neutral space to have these conversations. You don't want to make it feel like you're interrogating your teen or you're coming at them in a harsh manner. So finding a comfortable space where both of you feel at home is one thing that will really help in these first steps of the conversation. After you've been able to find this environment, simply let your teen know that you're worried about them and that you want to make sure everything is all right with them. This can be as simple as doing an emotional check-in with them and letting them know that they're there for you and that they can talk to you about anything that may be bothering them. And having in mind that when you do this, they may not necessarily open up right away, but you're setting that foundation for them to come to you if they so need to. So once your teen begins talking to you, which may not be right away, simply just listen to them without judging them. This is a very vulnerable time for them, and judgment will break the trust that your child is trying to establish by talking to you. So in this step, do not give your advice and simply allow your child to speak and express their feelings that they're experiencing without your opinion being interjected to their conversation. And also in this step, just try to remain empathetic to their feelings and avoid making any negative facial expressions, because your child will be able to read those facial expressions that you are having. And this is another way of just breaking the trust that they're trying to establish and cause them to no longer want to speak with you or to have future mental health conversations with you. And in addition to these negative facial expressions, try to avoid saying things such as, "You'll get through this," or "good things are going to happen to you," as this minimizes your child's feelings in the moment and can make them feel that their feelings are not valid because they have potential things that they could be looking forward to in the future. The third step among our list here is just to provide security and information. So after your child has fully been able to express to you their thoughts, feelings, and emotions, you can assure that although it is difficult to talk about their feelings, that you are there to support them without judging or condemning them. And then simply ask them that what can you do to help and be more of a support, and assuring them that you will be there for them. However, do not assume their needs and advocate what you think, and just simply listen so that they can fully express where they're at and what they need. So after your child has had their discussion with you and has fully been able to express to you where they are at with their mental health and what exact needs they need, and they've established their support with you, you should begin to encourage them to seek professional help and provide them with information on services that are available to you. And I'll go over some of those resources here later on in our video series. However, there's a variety of different ways to seek professional help, and that may be different for each teen based on their specific needs, coping styles, and insurance plans. So it's important to really keep all those in mind to find the best service for your teen in the moment. In addition to professional help, which can take a while to establish and create an action plan with caregivers, encourage your teen to practice self-care at home so that they can start their road to recovery from the beginning. And again, we'll go over some self-care techniques later on in our video series as well. Finally, if your teen is experiencing or is stating any thoughts of harming themselves or harming others, or they're showing thoughts of suicide, please reach out to the National Suicide Hotline, which will have the number right here for you all. And this line is important not only for your teen, but this line can also be called from yourself as parents and caregivers if you're concerned about your teen having thoughts of suicide, and they'll be able to talk to you how to best navigate that situation with your teen or young adult. Now I'd like to go over some additional conversation tips, because while having these mental health conversations can be tough for your teen, it's also important to acknowledge that these conversations are difficult as parents and caregivers, and they're often uncomfortable, and you may be feeling some fear and anxiety. So these additional tips will just help you navigate those mental health conversations with your teen. The first additional tip we have here is just make sure that you're being genuine with what you're telling your teen. Your teen will know if you're faking it or if you're feeling, and so if you're feeling uncomfortable, simply let them know by saying something like, "This is hard for me to talk about, so I understand if it's hard for you to discuss as well." And they'll really appreciate that vulnerability that you are showing to them while they're also being vulnerable to you. The second tip is try to avoid using any slang that you wouldn't normally use in an everyday conversation, because your teen will be able to pick up on this and it will just make it feel like you're not being genuine, as we kind of spoke about to that previous step. So really just stick to normal vocabulary that you would do, because parents and caregivers often try to use slang as a way to connect with their teens during these hard conversations, but your teen will be able to see that as something that's not genuine to you. And then the next tip we have here is just allowing for silence to happen. Sometimes silence is needed for your teens to be able to collect and articulate their thoughts. So although as parents, it may be instinct to want to try to fill these moments of silence, just be patient with your teen and give them that moment to think so that they can come to you when they are ready. And then, as I briefly mentioned before, a comfortable setting is important when it comes to having these mental health conversations. So some ideas to keep in mind are just picking places where conversation would naturally be stimulated. So this could be somewhere as the dinner table or while you're driving the car. Other activities include when you're walking the dog or when you're doing dishes. These are found more comfortable for parents to have conversations because they're not making direct eye contact with their teen, which both parties could feel as more intimidating and interrogating. So I like to recommend finding a space where you're sitting next to your teen opposed to sitting face to face, as this just makes both parties feel a little bit more comfortable in having these conversations. And then finally, just keeping in mind that you don't want to trivialize your teen's feelings. Mental health challenges can occur at any age, so by stating or wondering what someone at their age has to be stressed or worried or anxious about can imply that their experiences, feelings, and emotions are less valid simply because they are much younger than you. And as with anything, the more you have these conversations with your teen, the more normal and comfortable they will become over time. All right, thank you for joining us in our second series of navigating mental health conversations with teens. Please like, comment, subscribe, and we look forward to seeing you in our next video. Thank you. Bye.